I'm a private practice radiologist. I'm a body imaging specialist, and I work for Diversified Radiology of Colorado in Denver, and I've worked with this group since I started 18 years ago.
What would you consider a key finding or a key realization during the process of writing or the process of thinking about it that would be important for our readers to know, and how our readers, the clinical radiologists, can use your realization, your insight into clinical practice?
I think there's many things that would be helpful. And one thing that I want to stress is I don't think there's a perfect answer, and I don't think any one person can change how they do everything right off the bat. But I think there are many things that we can keep in mind that could make a difference. And one of the things that I didn't realize is that cancer is an emergency to the patient. When I used to see a follow-up cancer study, I would kind of think, this is not an emergency. I'm going to do the emergency cases first. I'm going to do the inpatient cases first. This kind of goes to the bottom of my pile. And now I think there's a person waiting for these results. The doctor's often waiting for these results. The patient's next step often depends on exactly what we say on that reading. And to that person behind the scan, it is an emergency to them. I also really just didn't realize how hard it is to go through chemotherapy, how hard radiation is, surgery. It was honestly shocking to me. And when my husband went through this, I had already been in practice for 7 years. So it's not like I was completely brand new. I'd been doing this for a while. And my husband was young and otherwise very healthy. And I thought, wow, if this is so hard for a young, otherwise healthy patient, how on earth can our elderly patients, frail patients, patients who have had cancer for a long time, go through our departments and even have a routine CAT scan? It's not the easiest thing.
I imagine that even being in the medical profession, it was still a challenge. And perhaps that was in part something that was also surprising and led to the question, if you, as an insider to the medical profession and the medical healthcare system, find it challenging to navigate, how much more challenging it is for someone who doesn't have the same contact or the same insight into how the processes are. Mm-hmm. So the perspective that you add is, I think, incredibly valuable, because it allows us or encourages us to take a step back and look at it through a different lens, and to try to facilitate where we can, when we can, acknowledging that it's not going to be